Carolyn Holland often wonders how life would be different if she'd gotten a mammogram. Diagnosed with breast cancer at 43, Canada's guidelines recommended against one.
Had I been able to access screening at 40, this wouldn't have been my outcome.
By the time she found the lump, the cancer was advanced, requiring aggressive chemo and a double mastectomy.
This shouldn't be happening, and this shouldn't happen to other women.
A group of cancer experts say the national screening guidelines, created by a task force of family doctors, are up to a decade out of date. Some provinces have gone against them in creating their own screening programs.
But unfortunately, a lot of family physicians are taught and trained to follow the task force guidelines.
Family doctor Anna Wilkinson, who also treats cancer patients, says the national guideline on breast cancer relies on old research.
One trial was 1963 that they're using to determine whether we screen women today, and that is completely irrelevant at this point.
The guidelines lag behind other countries. For example, Canada's task force still recommends against screening for HPV and against a blood test for prostate cancer.
I think they are harming Canadians because they are leading us to diagnose cancers at a later stage when we know survival is worse and when the costs of treatment are more.
The task force says there is a risk in screening too much. It could prompt treatment that's more harmful than the cancer itself. The group does consult with cancer experts, but those experts don't set the guidelines.
Someone who's been researching and advocating in the breast cancer or prostate cancer field for their whole career might have a different view than a neutral group that is trying to make recommendations for family doctors.
You're not saving us from harms, you're putting us in harm's way by denying us screening.
Carolyn Holland says patients like her deserve to know. Marina von Stackelberg, CBC News, Ottawa.